Folks, thanks for coming on the line with us today. This is John Dubas with Premier Marketing, a Vice President for Agent Success, and we'll be spending the next hour or so speaking to the use of low-income subsidy and Medicare Savings Programs to sell and help keep Medicare beneficiaries on the book. One of the things that makes Medicare Advantage programs so very attractive is the fact that they tend to be very persistent and stay in your book of business. And these programs can even affect that to a greater extent and make certain that the folks that you work so hard to get on the books stay on the books with you, and you do additional things for them through the use of these systems. A little bit of background and housekeeping. Today's presentation is being recorded, and follow-up will be sent to all who RSVP'd to today's event. We'll make certain that that comes out to you along with any of the attachments that are pertinent to today's presentation. So watch for that, and watch for some follow-up with the marketer that you have here at Premier Marketing. A bit of background, just as a reminder about our organization. We are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country and act as an insurance wholesaler offering insurance services to independent insurance agents in every state in the country. We do offer contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we are founded in 1968. We're founded in 1968. So this is our 50th anniversary, and it's a milestone that we're very proud of. It's a real success story for a family agency in a small town in Nebraska to grow into one of the largest organizations of its type in the country. We are the largest producer in the Medicare Advantage world, with a number of carriers, particularly United Healthcare, Anthem, and Meridian Care, and one of the largest carriers for many of the other programs whose names you recognize so very well. This gives you an indication of the extent of our offices across the country and our affiliate organizations. And the portfolio that we offer is a very robust one, including Medicare programs in the Medicare Advantage, Medicare Supplement, and Part D prescription drug world. And additionally, programs are offered for life insurance and annuity, including final expense life insurance, pre-need programs, long and short-term care, disability income, and ancillary benefit programs such as dental, vision, hearing, critical illness, cancer, and in hospital indemnity. These are very important programs as well in our Medicare space, because they enable us to fully cover an individual and leverage commission payments in the intervening time period here during EEP, where much of the Medicare Advantage and prescription drug benefit commissions aren't paid until after the first of the year. That Medicare Advantage portfolio includes just about every name brand that you can think of, and many of the strong regionals as well. And the same applies to these standalone prescription drug programs. So you have an opportunity to make certain that you can offer what is the most competitive programs in your market across the board. And that includes Medicare Supplement programs with some of the unique tools that we offer to help you do a diagnosis for the folks that you visit with. And with that in mind, we'll go through a little bit of a Medicare market overview, speak to the financial atmosphere that many folks in the Medicare space as beneficiaries encounter. We'll give you some specific information on both low-income subsidy, the Extra Help program, and the Medicare Savings Programs, and give you a little bit of oversight on some additional assistance programs as well. As we enter into this peak marketing program with the annual election period, much of what we do is much on a diagnosis basis, where we walk into a household, we ask questions, and we help people ascertain what might be the best choice they have to cover their health care needs. This little diagram here gives us an indication of the fact that many of the questions that we ask initially help us determine if a Medicare supplement program, a standardized, modernized Medicare supplement program with a prescription drug plan or without one, best suits their needs, or are the Medicare Part C programs, the Medicare Advantage plans, the best solution for an individual. Either way that we go into that, it's a huge opportunity, and it's one that the Low Income Subsidy and Medicare Savings Programs can help us reinforce the choice that our prospects and clients make. Obviously, when you get on a program such as this, or a webinar that is produced by a marketing organization like ours, or a carrier that's out there, we all speak to the grand opportunity in the Medicare space with the Medicare beneficiaries aging in to the market, the boomers becoming a very vibrant part of the people that we address. And these are people that are, well, over 10,000 a day aging in to the market. It's a daytime selling market. It's a grand opportunity for us to visit with people that need what we have to offer. It's a segmented market as well, with some very distinct characteristics. And these characteristics might be some of the questions that you ask to help determine what is the best solution for your prospects and clients. The median income for the Medicare population is about $26,200. So sometimes cost becomes a very viable consideration as to plan choice. The savings that come into play also is a piece that, along with the income, has a bearing on how a person qualifies for extra assistance, be it through the drug assistance programs or the medical cost programs that we'll go through. And you'll find that, obviously, for those of us that are getting older than we care to admit, some things go on with our body that changes how we view our needs as well. So we have an opportunity here then to help people address certain physical conditions by the coverages that we offer. It's also important to note that a category that falls on here is the one that speaks to the under 65 population with permanent disabilities, 17% of the Medicare population. And these are people that really need counseling about the services that we offer, because there are things we can do to really help them. And it helps as well for us to give them the information they need to make the choices between the plans that are available to them, because they are in a unique situation. One of the things that obviously comes into play when we speak to assistance programs deals with the financial challenges that Medicare recipients face. Social Security constitutes a huge part of the income for a good portion of the Social Security beneficiaries. And many circumstances, this gives us an indication that, well, back in my old Prudential days, we used to say people don't plan to fail, they fail to plan. And in these circumstances, you see that if Social Security constitutes a big part of their income, while they may have not had other savings put in place and had the idea that the government was going to take care of them. And so we find a good portion of the senior population, particularly, that fall into the poor or under the poverty level, or that are classified as near poor. And many of the folks that are on Medicare that are disabled because of that disability, they also encounter financial challenges. So some of the programs that we'll speak to today can make a big difference for them. It gives us an opportunity to not only solidify the choices they have, but enhance the benefits of those programs and aid in our persistency. Kind of a scary chart here. When you look at 23 plus 16 plus 10 plus 4, you're looking at 43% of the population with income as of this date in 2016 under $25,000 a year. And a good portion of the folks in those categories will qualify for some sort of assistance, as you'll see in just a moment. What we have now, too, is a unique part of the year. Obviously, halfway through, a little more than halfway through October, all of the plan choices are now available to the public. They were as of the 1st of October, obviously, but now we're in an actively selling period as well as of the 15th. And Medicare.gov has the information for all the programs that are available for the remainder of 2018 and for 2019 as well. That gives us then a peak period of activity during the annual election period, the open enrollment period for the Medicare population. We're doing this last quarter of the year, we work for the general population and help them with coverages with an effective date of the 1st January. This annual election period, the open enrollment period, obviously goes until December 7th, and there are 4 options that this gives to the Medicare population. It allows anyone with Medicare Parts A and B to switch to a Medicare Part C plan. It allows anyone with a Medicare Part C plan to switch back to traditional Medicare administration with Parts A and B active. It also allows anyone who has or is signing up for Medicare Parts A and B to join, switch, or drop a prescription drug plan. And it allows anyone with Medicare Part C, to switch to a new Part C plan as well. For folks that are already on Medicare and effective on Medicare, those coverages become effective as of January 1st of the following year on a general basis. As we go through and we look at how LIS and MSP affect these categories, we're going to go through those 4 choices and how they're affected by LIS Extra Help and how they are affected by Medicare Savings Programs. The yellow portions on the screen and the links below them speak to the National Council on Aging presentations for these 2 assistance programs. So those links that are on this page will take you to a overall presentation on these 2 subsidies as well from a different perspective. Much of that information is in today's presentation, but we wanted to give you another way of accessing the information. When we look at how LIS and Extra Help affects the folks that are with Medicare Parts A and B and looking to switch to a Part C plan, these folks then can use this program to affect the plan premium specific to the prescription benefit and or the plan premium penalty. So if someone enrolled in a Part D plan after they were first eligible, obviously they suffer the 1% penalty per month for the time period that they didn't have a Part D plan or a creditable coverage in place, and the low income subsidy at a full subsidy will actually take care of that plan penalty. It also affects the plan premium up to the national average. This is the first year going into 2019 that the national average cost has gone down a bit more than usual, we'll say it that way. And a lot of times we've seen some general upswing in the cost of the plans, but because of some of the legislation that came about and the subsidies or the lack of a tax that the insurance carriers have to pay, we saw a decrease in plan premiums overall. This year the national average is right around $29, where in the past we usually referred to it $30 to $32. It does vary by state. We have information as to how you can find that number for your specific state as well, and that will come to you as part of the follow-up to today's presentation. The low-income subsidy program does also affect different co-pays, co-insurance, and the gap coverage of the prescription benefits in the plans that you are marketing, and it overrides those co-pays and co-insurance that are set up for participants in those plans in general. So the people that qualify for low-income subsidy have different co-pays, even though the plan, in essence, is the same. Part of it is subsidized through this program. It does not, however, affect certain key components of the plan that they select. That includes the list of drugs that are part of that program, the plan formulary, and any step quantity or step therapy or quantity limits that the carrier has in the program that is selected. When you look at how LIS and Extra Help affects the second category of folks that have opportunities to change during this open enrollment period, these are the folks with Medicare Part C who will look to switch back to traditional Medicare administration, and if they select the Part D standalone premium, it will still affect that plan premium or the plan premium penalty if applicable. It still affects in the same fashion the co-payments, the co-insurance, and the coverage gap of the prescription coverage. And once again, it does not affect how the plan is actually set up to operate. The plan formulary, the list of the drugs, the step therapy or quantity limits that may be in play with the plan that they select. The third category that deals with anyone who has or is signing up for Medicare Part C and B that look to join, drop, or switch a Part B plan, the same considerations as the first two categories come into play as well. It still affects the plan premium or the plan premium penalty. It does affect the applicable copays, coinsurance, coverage gap of the prescription benefit of the plan that is selected. And once again, it allows the plan to operate as it's set up and does not affect the plan formulary, any step therapy or quantity limits that the plan is subject to. When we look at the fourth category and how the extra help affects people who have a Part C plan and are looking to switch to a different Part C plan, it affects the prescription coverage if it is integrated into that program. So an MAPD program, a Medicare Advantage prescription drug plan, the copayments that are set in play for that, and if the plan charges any premium for the plan type and it is associated with the prescription benefit, it will affect that plan premium or the plan premium penalty, and it does still affect the copays, coinsurance, and coverage gap of the prescription benefit. So it comes into play, that circumstance, and once again does not affect how the plan administers the benefits. So the drug list, once again, stays constant, and any step therapy or quantity limits on certain medications that are in play with that program still are in effect. When we look at how the second portion of these assistance programs affect those four choices, we'll do the same thing that we did with LIS Extra Help, because keep in mind that assistance program is for the prescription benefit. When we look at the Medicare Savings Programs, these are the assistance programs that help with the Part B premium, and in some circumstances, depending upon the level of assistance within that Medicare Savings Program, it can affect the out-of-pocket exposure that the person has for deductibles and coinsurance with traditional Medicare and with Medicare Advantage programs. So the people that have Medicare Parts A and B and are looking to switch to a Part C plan and have a Medicare Savings Program, well, this, once again, it affects the prescription benefits, just like with the LIS benefit, because that is part and parcel of this program as well, but it also can affect the medical cost and the Part B premium, dependent upon the level of assistance. It can also, depending upon how qualified, if an individual is fully subsidized, it can affect the plan choice as well, because some of the special needs Medicare Advantage programs, well, some of them require that a Medicare Savings Program of a certain level be in effect for that individual for them to qualify for that particular SNP plan, special needs plan. It can also affect the the medical and prescription copayments, the coinsurance, and the coverage gap of the prescription benefit once again, and it still does not affect the formulary and any step therapy or quantity limits that a person is subject to with their plan choice. For the folks that are on a Medicare Part C plan and are looking to switch back to the Medicare traditional administration of Parts A and B and select a Part B program, it again affects the Part B premium that they pay to the government. Now remember, the Part B doesn't go to an insurance carrier in any circumstance. It still goes to the government. It does also still affect the prescription drug premium and any penalty that they may have. And it does, in certain circumstances, affect the need for a Medicare supplement, because the folks that are true dual beneficiaries, in the vast majority of the circumstances, you can't sell them a Medicare supplement. It's against regulations. It does affect applicable copayments, coinsurance, coverage gap of the prescription benefit, and once again, doesn't affect the formulary, step therapy, or quantity limits that are inherent in the plan choice. When you look at how an Medicare Savings Program affects someone who's looking to change or drop or switch a Part D plan, this too affects the premiums that come into play, both for the prescription benefit and still has sway over that Part B premium that they pay. It also affects the premium penalties, not only for the drug plan, but also for that Part B premium if they did not enroll when they were first eligible as well. And once again, it can affect the need for a Medicare supplement, just as it did in the previous category, where someone's at 100% of federal poverty level or below, purchasing a Medicare supplement program in most circumstances is not a viable option. It still affects the applicable copayments, coinsurance, and coverage gap of the prescription benefit, and it doesn't once again affect the internal workings of the prescription plan that they have selected, including the drug list and any constraints on the choice of medications working through a step therapy program or through quantity limits that are imposed by the plan choice. For those folks that have Medicare Part C that are looking to switch from one C plan to another, from one Medicare Advantage plan to another, Medicare Savings Program can affect and will affect plan premium for both the medical and prescription benefit and any applicable plan premium penalties. It can affect a plan choice once again as well. If a SNP plan is available in that particular market, a D-SNP program specifically, because that is once again a requirement for many of the programs to participate in that particular type of Medicare Advantage prescription drug plan. And it does affect copayments, coinsurance, and coverage gap of the prescription benefit and the medical benefit as well. And the machinations of the plan itself with the list of drugs that are part of that program, step therapy and quantity limits still come into play. So what's the value of the prospect of these assistance programs? Obviously, anyone that qualifies for these programs, it helps maximize the plan benefits that are available to them, gives them additional assistance, and minimizes plan choice and costs that are part of the program. And it does affect what they're going to come out of pocket for with any of the plans that they may enroll in. Because keep in mind, these programs, the assistance programs, the entitlement programs, however you want to label LIS Extra Help or Medicare Savings Programs, it affects what they're going to come out of pocket for depending upon the level of the assistance that they qualify for. And we're going to go through those specifics in just a moment. How does it affect you as the insurance agent, as the advisor to this population? Well, first and foremost, if you help people with these plans in place, obviously you're going to examine some of the choices that are available to them and help do what is best for that person based on the additional assistance that they have, and put them in a program that they qualify for that gives them the maximum benefit, obviously. But it also helps you that if they qualify for this assistance and don't have it in place, which we're going to go through how you can help them with it, and you do help them get those additional assistance programs in play, well, you are really doing what is best for your client, and you're maximizing the benefits that they are able to access once all of this comes into play. What that does for you is it does make it much more difficult for any other agent to replace your product, because folks do remember, or the vast majority of them anyway, that you have done something extra for them, you help get them additional assistance, and that aids in your persistency a great deal. It also can help enhance a program that has lesser benefits, be it the plan that they're on or some additional choices, because these programs pick up the slack on what comes out of pocket in many circumstances, and it enables you then to really enhance the benefits that are set up by the carrier itself with these assistance programs. And as you go through this open enrollment period and you run across an individual that is already enrolled by someone else, they beat you to it, and you create a SEP, you can still do a change based on that special election period, because you're creating it through the use of these programs, and it helps you manage your time. As you run across a dual beneficiary in that first week in December, and all other things being equal, you can obviously set the time necessary to visit with that individual to someone who doesn't have one of these assistance programs, that doesn't generate a SEP, and you can then visit with those folks later in the month using the SEP to change their program and see more people by simply sorting through the eligibility of the folks that are your prospects. One of the things that this does as well is it does increase the likelihood of a referral. We tend to hang out with people that are a lot like us, so when you run across an individual who qualifies for low-income subsidy or Medicare Savings Programs, in many circumstances, they know people that are in exactly the same situation they are, and by visiting with them at an appropriate date, it enables you to keep your marketing program and the scope of the individuals that you can visit with and help going throughout the entire year. So this slide gives you a number of reasons why you really want to be aware of low-income subsidy, extra help programs, and Medicare savings programs. It doesn't necessarily mean you have to target that portion of the population, but by knowing some of the parameters of this, it's going to help you see more people. It's going to help you keep more people on the books as well. Some of the things that we see that are influenced by this is the fact that we mentioned earlier the average income being $26,200 for a Medicare beneficiary as of about a year and a half ago. That population spends a little over a third of their income on health care alone. So you're being able to alleviate some of the costs that are associated with either their medical expenditures or what they have to pay for their prescription drugs. Not only helps them in dollars and cents, but it enables them to have additional monies to do other things like live through the rest of the month. You can make a real huge positive influence on the people that you visit. And as we go through and we look at how many people this can affect, well, looking at an older survey from nearly 10 years ago, we saw where almost 2.5 million people qualified for a subsidy but did not have it in place. So this is one of the reasons why we want to be aware of some of the numbers that are coming up, because it enables us to access a greater portion of the population on a year-round basis. Because remember, these folks will qualify for a special election period. And we look at that income, it makes a huge difference as to what we can do and the people that we visit with. And obviously, you know, when you listen to different carriers give you an approach as to how you sell Medicare supplement programs or how you sell Medicare Advantage programs, one of the key factors that comes into play is what can folks afford? What program can you put into play that will stick? And you look at the value of low-income subsidy, and the average annual value of that program is right around $4,000. It's a huge influence on the lives of the people that you're visiting with. It can make a big difference as to the size of your book of business and how it grows on a continuous basis. So some of the things that that extra help program does, once again, is it gives them access to prescription drug coverage that they may not be able to afford even the plan premium in certain circumstances. It also helps protect people from the coverage gap, the infamous donut hole, and we'll visit as to how it does that. It waives the late enrollment period or penalty for Part D, as we mentioned, as we went through the different categories with both of the assistance programs. This says it allows a continuous special enrollment period, a SEP. That is still true through the end of this year. Beginning in 2019, however, this special enrollment period goes from a monthly possibility to one that is based on a quarterly basis. So they can only do an enrollment change the enrollment every 3 months as opposed to each and every month as it has been through the remainder of 20 2018 going into 2019. An application for low-income subsidy also triggers an application for the Medicare Savings Programs. So what it does is if you assist a person in getting extra help, it will trigger an application within the systems to see if they qualify for additional help through a Medicare Savings Program as well. Even though this is triggered automatically, if you, through your knowledge of the systems, realize that they would also qualify for an MSP, there is a process you can go through to expedite that application process as well, and we'll talk about that here shortly. To be eligible for low-income subsidy, a person has to have Medicare Part A and or Part B. They need to live within the United States, the 50 states or the District of Columbia, and they have to meet certain financial criteria, including an income test and a resource or assets test. If folks are deemed eligible because of other needs-based benefits, such as full Medicaid, SSI, or if they're already in a Medicare Savings Program, they are going to have this assistance for their medications automatically, and they don't have to apply for LIS. But once a person is found eligible, they get the low-income subsidy for at least the remainder of the calendar year. There are two levels of assistance. It is the full level, the full help, full subsidy that comes into play based on income and assets. And then there are also partial subsidies, partial help programs for folks that have slightly higher income and resources. So both the full and partial subsidies eliminate the Part D coverage gap, and they help eliminate the late enrollment premium that may have come into play if someone got into the drug programs after they were initially eligible without creditable coverage in play. When you look at 2018, it is a opportunity for the LIS to take care of the plan premium completely based on a benchmark plan. So if you have a Part D program that is above that benchmark, the person, if they were to consciously enroll into such a program, they would be subject to payment of the premium above that national benchmark. It does eliminate the Part B deductible, and it puts the co-payments that that person has to pay at standardized numbers. So if the Part D program that a person enrolled in, they didn't have LIS, and they were to pay, let's say, $6 for generic medication, and they then found that they were eligible for low-income subsidy, got qualified for it, instead of $6, they'd pay the $3.35. So it makes a difference for those individuals, as I mentioned throughout the earlier portion of today's presentation, as to what they come out of pocket. These are the numbers that come into play for full eligibility in the continental United States, because the eligibility in Alaska and Hawaii is slightly higher. Keep in mind, it's an assets test and an income test, and it varies if someone's a single person or if they have that marriage penalty, so to speak. The partial subsidy for LIS is a sliding scale on the premiums dependent upon their income. They have a smaller deductible that comes into play. They have a smaller coinsurance for the plan covered drugs if the plan has coinsurance as part of the coverages that they select, and it then still affects the copayments that they have on the plan, can lower them from what the plan states. This is a higher income that is available to an individual so they can make more money, have more money coming into the household, and still qualify for the assistance on the medications and the drug plan that they select. Keep in mind, these numbers are coming to you, so as I slide through this, you don't have to worry about writing them down. They're going to come to you. On the income test, what counts as income? Well, any Social Security benefits or railroad retirement benefits. if they have a pension or annuity, including a veteran's pension, any wages that they have on a gross basis, earnings from self-employment on a net basis, any alimony that's coming into the household or rental income on a net basis. It excludes income from food stamps or fuel assistance. It gives them a $20 disregard, and it also disregards work-related expenses for people who get Social Security benefits for disability or blindness. This link will give you a full breakdown on these resources through the link to the National Council on Aging. The resource test, what counts as a resource? Any financial institution accounts, a checking, savings, or CD account, any cash that they have and claim, stocks, bonds, savings bonds, mutual funds, IRAs, 401k accounts, any real estate that they own other than their primary home, and certain trusts that allow them to revoke the monies that are in that trust and have direct use of the funds. It excludes resources such as the home in which they live, all vehicles, household goods, cash surrender value of life insurance policies, in-kind support, so if a family member pays their rent or pays their electricity or utilities. And it also disregards irrevocable burial trust and burial contracts. There are two ways that a person can actually apply for this extra help: online through the Social Security website or through benefitscheckup.org. The online application is available in English and Spanish, and it accepts an electronic signature to complete the application. So it can be done completely online. There is a paper form that someone can obtain from a Social Security office, either visiting one or getting it by mail, and submitting that after its completion. And the Social Security Administration makes a determination, usually within 3 weeks, of the completed application and sends the applicant a decision letter. Benefits Checkup is a great way not only to go through and see if a person is eligible for this assistance or some additional help that might be available. And then, of course, different SHIP programs are very helpful as well. Applying online is not only easier than a paper application because they kind of walk you through the process, but it's also faster. Much as what we see as a producing insurance agent and us taking applications on paper, we have to deal with our handwriting, perhaps missing a question. Much of the electronic function in the world today helps eliminate some of those shortfalls. These programs do not require verifying documents to be submitted. The Social Security Administration uses federal records to verify the answers, and if a paper form is incomplete, the Social Security Administration follows up by phone to get the additional information. Much like all the applications we use in the insurance world, you can't submit the application if it isn't complete, but instruction sheets on this are available in 15 languages on Social Security's website. So it is a very friendly tool for folks with different mother tongues to take advantage of and to apply for. This is some samples of the paper application and the online application that a person would use. It'll ask for, some of the specifics, obviously, for the individual: the name, address, Social Security number, the financial information, the income and assets that come into play, household information. And this is a sample of the letter that the applicant would receive after the application has been processed. So if you have an individual who qualifies for this assistance, what would you do? Obviously, you can point them to the Social Security website or a Social Security office to help with the process as well. Or you can go into the Social Security website as their advocate, legally and compliantly, and help them complete the application in that fashion. This page will give you links to much of the reference material that can make this so much easier for you should you choose to do it. Now, as I went through that application and we saw how simple it was, keep in mind it generally doesn't take very long at all to take that extra step and help someone with the application process. They'll give you detailed information and update as the numbers come available for 2019 as well. Once that person is in play, remember in 2019 it goes to a quarterly special enrollment program, and that person then has the opportunity to change their coverages as their circumstances change or as they become aware of other programs that may be more beneficial to them than their current choice. There are also additional assistance programs available to folks that haven't quite worked their way completely into the Medicare system, and this is available to them as well. Once again, some of the things that you can do to help your folks, and this makes a great community activity as well, is to share the resources and your knowledge and help them review the correspondence that they get about these different options. It's a great way for you to render a service to the community and market while doing so. As I mentioned a little earlier, application into the low-income subsidy program will give them an opportunity to automatically start the process for the Medicare Savings Programs. And however, you have an opportunity, if you know, based on some of the information we're about to give you, that they would qualify for a Medicare Savings Plan as well. That obviously helps them even to a greater extent on a financial basis, and it gives you an opportunity to help with that application should you choose to do so. When we look at Medicare Savings Programs, there are different types of coverage that come into play. Eligibility rules are different for the different assistance programs, and it can make a difference as to how it interacts with other benefits that they may have available. So we're going to give you some of that information here. Medicare Savings Programs are Medicaid administered programs funded jointly by the state that the individual resides in and the federal government, and it helps with the cost on the medical portion that they have with Medicare. They are called different things in different states, and there are some different qualification factors based on the state in which the individual resides. The first of these programs that has been in place the longest is a qualified Medicare beneficiary, a QMB individual, or a QMB. This program pays the Part A premium if applicable and the Part B premium as well, and pays the Part A and B deductibles, co-payments, or co-insurance. So this is a program obviously that is in play while they don't have a need for a Med Sup. It does help them qualify for a dual special needs program, and that can be advantageous to them in certain circumstances if available in their market. A specified low-income beneficiary, a SLMB, SLMB individual, this person receives assistance for the Part B premium, as do the folks that are a qualifying individual, QI individual as well. So 3 different levels of assistance in Medicare Savings Programs there. There's an additional level that we don't run across quite as often, and this is the QDWI, and this is a qualified disabled working individual, and it makes a difference for these folks because it can really help pay the Part A premium if they were disabled before they had worked enough quarters for Part A to be fully funded or hadn't worked at all. Some of the things that MSPs can do for an individual, much as what an LIS program does with the penalty for the drug program, these come into play as well for the Part B premium penalty if applicable for that individual. So it waives that premium for the folks that qualify for the first 3 categories. Unlike programs that you see for long-term care and nursing homes, no estate recovery comes into play with these individuals, and people who qualify for an MSP automatically qualify for the Part D extra help programs as well. When you think of the savings that any of these subsidy programs have for a household that qualifies for it, and you realize that even a SLMB or a QI program that just pays the Part B premium, well, that $134 a month for the majority of people on Medicare at this point in time, and you take that $1,600+ a year and looked at their annual income, it's a huge difference for the quality of life of the individuals who qualify for this assistance. There are different government entities that come into play here. So you have CMS in the states that help work together to provide this assistance. CMS provides the matching funds for QIMBY and SLIMBY, and it provides 100% of the cost for the QI through a block grant. The state Medicaid agencies administer the benefits themselves. They are the entity that determines eligibility, pays the Part B premium on behalf of the qualified individuals, the co-payments, co-insurance for those QIMBYs that qualify for that assistance, and also look out for the folks that have a Part A premium due as well. Who's eligible for these programs? Well, anybody that has Medicare Part A and meet certain income and assets tests. Once again, the assets test is not a requirement in every state. 8 states, Alabama, Arizona, Connecticut, Delaware, Mississippi, New York, Oregon, and Vermont, and the District of Columbia eliminate the resource test, so that's not part of the play in those particular states. The applications are generally submitted through local Medicaid agencies, many times located within Social Security offices. Folks can do this through a paper application or electronically as well, and the eligibility is generally redetermined each and every year, much as comes into play with the LIS program as well. The financial criteria for these programs, 100% of federal poverty level goes up to 135% of federal poverty level. And if you think of what's the max then that someone can earn and still get some kind of help, well, the LIS maximum is 150% of federal poverty level. So that gives you an idea as to how much a person can bring in and still qualify for some help. On a round number, if someone is grossing $1,500 thereabouts or less and meet the assets test, the resource limits, they'll probably be eligible for some sort of assistance, at least for their prescription drugs. Once again, those excluded assets, a house and a car. Doesn't matter the value of the house or the car. It also excludes the household goods and wedding engagement rings, burial spaces, burial funds, up to $1,500 a piece, and life insurance with cash value of less than $1,500. That QIMBY program was established by Congress in '88. 38% of the folks that qualify for it are not enrolled in the program. This is why it's so important for us to have some general numbers in our head as we visit the folks that we work with through the annual election period, because there are things we can do to help them. If you think of, once again, that $134 a year for the, or pardon me, a month for the Part B premium for the SLIMBs and QI1s at least, they're going to make a huge difference in their life. And the vast majority of people who qualify for that assistance don't have it in place. So our being aware can make a huge difference in the lives of the people we visit with, and give this information to. This is a nice slide to have in your presentation binder, because it gives you the numbers that come into play for an individual and a couple on both income and assets tests, and gives you reference in your discussions with folks across the board. And speaking from experience, you can't always tell a book by a cover. You can go into a very nice house where an individual might be living with an adult child, and it's their house. The house doesn't apply. Financial circumstances can be very different through the generations, and asking a general question during each appointment and not assuming what monies are come into play can make a big difference. Some of the reasons why folks don't have an MSP, well, sometimes they just don't know about it. And the lack of knowledge about these programs is a big determining factor. And the enrollment process isn't always that easy, and some folks will start the application process and don't follow through. And then even if they knew of folks that can help them, that don't come to them, like Social Security offices, sometimes it's difficult for them to get there to get the help. And we are dealing with a very proud generation here as well, where some folks, well, they have that misplaced stigma that these recipients are on welfare. So there are things that you can do to help them. Be familiar with the eligibility and at least point them in the right direction, or go through the application process with them and make certain that you're helping them get the different assistance programs to which they qualify, because there are issues that come into play as well, and you can be an intermediary for these as well. So there are circumstances where if a person has A and not B, well, the state Medicaid agency must enroll them in the Part D program through the application process. That may affect the timing as to when they get the additional assistance. If they don't have A, well, you got a conditional enrollment here, and the Medicaid offices have to be of great help there as well. Certain states have a short form, not all of them. I know of a few states that the application is 15 to 20 pages. So it's something that many times they really need the help to get it into play. And once again, it's a simultaneous with low income subsidy and can be triggered by the application process as well. So there are different programs that are set up in place that can help you help an individual. Obviously, Social Security offices, social workers at those locations can be of great help to you. Certain carriers also have additional assistance programs built into the back office support they offer you as a contracted agent. My Advocate program, benefits checkup, different programs at different carriers come into play, can be a great assistance to you. And many of the carriers, the vast majority of them now, also have a means that you can call into the agent support and find out what level an individual has as well. So being proactive in this process can really help you on a year-round basis. Once again, you can help people qualify for this assistance quicker by having the application process eased for them through your assistance, and keeping in mind that the numbers that you and the applicant put on these forms, well, you don't have to submit documents to support those numbers at the time of application. There is many individuals who will say, well, my income is there, my assets is a little high, what if I give some of that money away? Well, there's a look-back program. Now, in most circumstances, 5 years, with very limited exceptions for that program. It also is the process where the application process for Medicare Savings Plan is longer than that of an LIS program, and it's important that as we fill out these applications that we be specifics, give them specifics on numbers for income and assets as opposed to rounding off. There are certain states that have demonstration programs for Medicaid, and this can make a difference as to how they seek care or have billing come to them through the different programs. It varies from state to state. It used to be a bigger challenge in the past than it is now, because there is obviously greater experience with a lot of these programs now than there has been in the past. And you have an access here to get additional frequently asked questions about these programs through the link there. The relationship that Medigap has with Medicaid, this is one of the things that we were referring to earlier in the presentation. We're dependent upon the level of assistance they get with a Medicare Savings Plan. If they're a QIMB, well, it's going to pay all their Part A and B cost sharing anyway, so those folks should not be sold a Medigap policy. And SLIMBs and QI1s only get the Part B paid for, and there may be circumstances where the program choices are limited and you have to do what is right for that individual. There are also assistance programs for people in long-term Medicaid. A lot of what we do as independent insurance agents during this time of the year particularly don't go to anything other than community-based programs, so it's important for us to keep our focus at this time as well. as we mentioned before, a person who has MSP automatically has the low income subsidy assistance, and that process we can help facilitate. You've got additional reference material here available through the government sites, through Medicaid, Benefits Checkup, the National Council on Aging. These links are coming to you as part of the follow-up to today's presentation. There are also additional assistance programs that you may be in need of having at least some exposure to, and these are laid out through Brain Sharks and other educational materials through the National Council on Aging. That includes the Supplemental Nutrition Assistance Program, formerly referred to as food stamps, and the Low Income Home Energy Assistance Program that helps with utility cost as well. When you deal with folks that are of really depressed income, SSI can come into play. We're giving you access to these informational programs because you're not going to run across these individuals nearly as frequently as you would for regular MSP or LIS programs. Some of the additional help that you're going to get from us here at Premier, well, keep in mind the agents that work with our organization do have access to discounted E&O that truly makes them an independent insurance agent. That's one of the things that you have in your quiver, so to speak, is the ability to offer programs with multiple organizations and multiple carriers. This is very regionally priced E&O that covers all programs that you represent. We also help you keep your license in place through discounted continuing education programs. And as we went through all these different programs and we realized that multiple carriers may be necessary for us to really give a full view of what we have to offer, creating an agent profile through SuranceBay allows you to contract electronically and much more quickly through the systems that we have in place. We do a ton of educational programs such as this, and we've done a ton in the past. So